Welcome to Nursing School Explained, and this video of a pediatric dosage calculation example for ibuprofen. So this is a medication that you'll come across quite a bit in the clinical setting and or even at home because it's a commonly used medication. So here in this example, we have our order ibuprofen, which is a pain reliever, 5 milligrams PO, Q 6 to 8 hours, PRN pain 1 to 3, which is mild, or ibuprofen 10 milligrams PO, Q 6 to 8 hours, PRN pain on a scale 4 to 6, which is moderate pain. Now, what we have available in our drug cabinet by the pharmacy is 10 milligrams per 5 milliliters, and we better go through our medication checks and make sure that it is labeled as ibuprofen. And in our example, the child's weight is 46 pounds and their pain is a 2 out of 10, which is mild, and also a 6 out of 10, which is moderate. So we'll go through both scenarios here. So as you might already know if you've been following my channel, I'm a big proponent of dimensional analysis. So we're going to go ahead and calculate this by using dimensional analysis method, because you can calculate any drug problem, no matter how simple or complicated it is with this method, by following the same step each time. It'll always be right. So let's go ahead and take a look. So first of all, we'll figure out what are they asking us to calculate. They want us to calculate milliliters per dose. And so we're going to go ahead and set it up as such, milliliters per dose. And we'll start with the first one. So in this case, we're going to start with the mild pain scale, which is the 5 milligram dose. So the milliliters on top here, where we have this given, is in the availability. So I'll put my 5 milliliters over the 100 milligrams right here. Next, I'll go ahead and I'll see what my order was, which was the 5 milligrams per kilo. Your doctor didn't pay particular attention, so you have to make a phone call and clarify that. So 5 milligrams per kilo per dose. And this is I made a joke here, but really this is a very important fact, because medications in the pediatric setting are always weight-based. So it's always going to be a certain number of milligrams or micrograms per kilo. So if you don't have that order written out, then you have to make sure that you get that clarified, because 5 milligrams for a 6-month-old and 5 milligrams for a 6-year-old are going to be very, very different. So it's milligrams per kilo. All right, so let's continue here. So 5 milligrams per kilo per dose. And then we need to convert our kilos to pounds, and 1 kilogram is 2.2 pounds, and then put in our patient's weight, which is the 46 pounds. And then with dimensional analysis, we'll cross cancel all the units that we've put in: pounds, kilograms, milligrams, milligrams. What we're left is milliliters per dose, and this is exactly what we were looking for. And then we'll go ahead and we'll come up with our math here. So for the 5 milligrams, it comes out to 5.2 milliliters per dose. All right. Actually, it came out as 5.23. It is common practice to round liquid medications to the first decimal, but make sure you are aware of what your school requires in order for you to pass the exam. So for our 5 milligrams per kilogram dose for the mild pain, we would give 5.2 milliliters per dose. Now let's go ahead and calculate the second scenario, which is the 10 milligrams per kilo for the moderate pain. And now our patient has a pain 6 out of 10. So we'll set it up the exact same way, milliliters per dose. And our availability is still the same, coming from the pharmacy, with 100 milligrams per 5 milliliters. Then we'll go ahead and we'll plug in our dosage, 10 milligrams per kilo per dose, We'll have our kilo to pound conversion and our patient weight. All right, same scenario, so I'll go ahead and I'll cross cancel. Kilo, milligram. I'm left with milliliters per dose. And I'll go ahead and I'll do my calculation, and this one comes out to 10.45, which I'm then gonna round off to 10.5 milliliters per dose. So this was our second scenario. Now, if you take a look here, the dosages per kilo was exactly double. So the first scenario we had 5, the second scenario we had 10 milligrams per kilo. And in this case, we have 5.2, and if we would double that, it would come out to 10.4. So really, it makes sense to reflect back at this and see if it makes sense. We just have 1 decimal difference here because 10.4 would be 0.1 less than this, but this is just because of rounding, but it still makes sense. So this is a quick way for you to double check your calculation. Now, some people, what they will do is they will go ahead and calculate the first one and then just multiply their result by 2 to come up with the second dosage calculation, which is also doable if you're very confident in your skills. But if you're still new and you're starting this, I highly recommend setting up the whole dimension up again, because that way you have an independent double check, and once you come up with the final result, you can double check and see if it makes sense, if this has doubled just like the 5 has doubled into the 10 milligram dose there. So thank you for watching this video. Also check out all the videos I have about dimensional analysis, where you can get confident in your skills and pass any dosage calculation like a champ. Also check out my other medication videos, and I'll see you soon right here on Nursing School Explained.